What up, fellas? It's Ty. Welcome back to the channel. We discuss all things prostate and prostate cancer related. If you're new here, welcome. I'm a prostate cancer survivor. I share tips, things you should know, and some things that may help you understand better what your doctor and your caregivers discussing with you. If you've been here the whole time or you've liked and subscribed, I appreciate you. Today we're going to talk about the thing that I get the most questions about when I start discussing prostate cancer. The first question I get is, hey man, what symptoms did you have? And I know they're all different, so I'm going to discuss mine. If you didn't have this, or if you had something different, please add it respectfully in the comment section so that individuals can feel this is a safe space and they can discuss this in a way that they may not have been able to discuss it at any other point or even felt comfortable doing so. So for me, my symptoms were a little weird. Again, it's always tough for me because I don't share anything. And so sharing this is just for you. I won't say that it's not therapeutic, but this is just for you. So the first thing I noticed is that my stream when I was urinating split into two. That could mean any number of things. But I would, if I had to urinate really hard, like really badly, it would split right into two. And I didn't know what's going on. So I casually mentioned it to my primary care physician a couple of different times. And, he was like, well, we discussed it, but it wasn't, oh, that's a problem. Then you compound with this thing that I call the hood, where the foreskin, it almost as though the penis was retracting into the foreskin. And that was happening when I was out, like I'd be playing sports and I would have on compression pants and it would contract all the way in. And I was like, hey man, what is going on? So I had a conversation. I said, look, my stream's breaking in two and I have this. And so those two things in and of themselves were not indicative of prostate cancer, but they did push me to start paying attention. And that's when I felt a dead feeling down below. Now, I don't know how to explain it to you, but it was just like it wasn't like a tingling feeling or like when something goes to sleep, but it was just, I just didn't feel anything. It wasn't that I was having erectile dysfunction or I was having some, I had an enlarged prostate already, so I was watching that. So that was another thing that was complicating it because I had been diagnosed with an enlarged prostate. And so everything that we were talking about immediately was like, oh, well, maybe it's your enlarged prostate. But I had all of those symptoms going on. And then when my PSA went up, I was like, okay. So the PSA is the blood test to check your prostate. So, they do the digital exam, but they also do a test where they draw your blood and check your PSA. So I was checking mine because I was hovering around 2.4 or so. And as I said before, when I went for my physical, I came back to 3.4. And I knew that 4 was bad. So 3.4 was high enough for me. That was just too close and too much of a jump. There had to have been something going on. At least I thought there had to have been something going on for that. And later we found out that that was in fact the case. So why am I telling you this? I'm telling you because you are a guy, you've had your penis your whole life, and you know if something is different. You need to, as soon as this happens, go get checked out and make sure you get the answer you want. Now remember, your primary care physician is there for primary care. A number of us guys are lazy. We go to the primary care physician, they tell you nothing's wrong, you go on to the house. But a urologist will get to the bottom of why you're having that issue below. So if you do not have a urologist, ask your primary care physician for a recommendation. If you need a prior authorization or something like that, get that from them. But go seek that out or ask someone for a urologist in your area and go see that person. It is very, very, very important that you make sure that you get that done because it is not easy. It is not the easiest thing in the world to do, but you have to do it. So at the earliest onset of those symptoms, when stuff doesn't feel right, when your erection is not quite as hard, you will tell yourself, this is happening because I am getting older. You need to go make sure that that's what's going on. Now, I'm not going to tell you. A lot of people will tell you that they've had a lot of different other symptoms, and hopefully they will share what those are. And maybe one of those will, kind of push you forward. But again, all of these videos are to push you forward towards action and not towards a medical advice or anything of that nature. You need to talk to your medical provider if you have a medical issue. But as far as the rest of us are concerned, our community is set so that you are aware of what's going on and when you need to seek treatment and to whom you need to seek treatments from. Because your urologist will check, make sure, and get in depth on a way that your primary care physician cannot. There's no need to go to an our area patients first or one of those doc in the boxes and have them tell you that nothing is wrong with you, give you some antibiotic or something. Because when they gave me an antibiotic, my PSA went from 3.4 all the way back to like 2.7. And they were like, oh, well, it wouldn't be going down if you had prostate cancer. Well, I had prostate cancer. So if you go to that doc in the box and you have, you get some antibiotics, there's a chance that your PSA may go back down as well. And you may be sitting there thinking that you're fine. And you may be in the same situation I was in, where your prostate cancer was a little higher than your doctor could find on a digital exam, or that your PSA wasn't quite indicating over the 4 limit that would require them to actually do something. So be in charge of your care, fellas, and do not be lazy. There is no need for you to be in a bad circumstance for not going to the doctor. As always, fellas, peace and blessings. I'll let y'all later.